Hi, welcome to the Health Informatics Seminar. My name is David Potenziani. I am looking at about three different screens here. Today we have an interesting and what will become with another presentation later this term, a comparison of health informatics education. But first, I am going to ask Dr. OG to introduce our speaker.
Hello, good afternoon, everyone. My name is Dr. Erezi Ogbo-Gebhardt. I am an assistant professor at North Carolina Central University and one of the co-organizers of this seminar series. It's my great pleasure to introduce our speaker today, Dr. Annabelle Castillo-Mora, who currently serves as a lecturer in health information systems at Higher Ed Colleges of Technology in Abu Dhabi, UAE. I am especially delighted to welcome Dr. Castillo-Mora today because we both share a connection to Carnegie Mellon University, where we both received our PhD in engineering and public policy. Dr. Castillo-Mora is a health services researcher and academic with expertise in digital health, health economics, and nursing workforce research. Her teaching and research focus on digital health policy, health information management, and the application of data-driven approaches to improve healthcare quality and efficiency. Dr. Castillo-Mora has extensive experience in leading multi-stakeholder research initiatives in the United States and internationally, including projects with the American Nurses Association on the economic value of nursing and the development of standardized terminology frameworks to support nursing research and practice. She has published on the economic impact of nursing and has presented at national and international conferences. Her professional background combines her doctoral training in engineering and public policy from CMU with applied expertise in healthcare management and quality improvement. She has served in leadership roles, overseeing research collaboration, institutional review board submissions, and disseminations of findings to diverse audiences, including clinicians, policymakers, and healthcare administrators. Her current research interests include digital health innovation, competency-based education in health information management, and advancing methods to measure and communicate the value of healthcare workforce. Today, Dr. Castillo-Mora will be speaking on health informatics education for a changing healthcare landscape in the UAE, which promises to provide valuable insights into how we can tailor global best practices in teaching to local contexts. Please join me in welcoming Dr. Castillo-Mora.
Thank you so much. Thank you, Resi. I appreciate that introduction. And yes, we have had an opportunity to share a lot of great moments as students at Carnegie Mellon, and I was really happy to hear back from you, and I was really happy to have this opportunity to talk about my experience in health informatics education. I haven't been here very long, but I have already learned so much about the differences between higher education in a country like the UAE compared to my experience, both in Ecuador, where I had my undergrad, and the United States, where I was able to complete my higher level degrees. So happy to talk a little bit about it and open it up for questions if you have any. For this presentation, first of all, I want to talk a little bit about health informatics in the UAE. So the United Arab Emirates is a country that has been very recently interested in investing in healthcare technology for a few years now. There has been this growth of health tourism, as they call it. So they have tried to create this environment where people from countries that are close by can come in to receive top of the line healthcare services in the UAE. And that part of that plan is a lot of investment in health innovation, health technology, and health informatics. So I will talk a little bit about what that means for education and research, but it has become something that is a big priority for the UAE government to be able to use top-of-the-line health informatics and to have personnel and labor trained to be able to use these informatic tools. So, like I said, there's a government vision of really embracing AI in healthcare, using a smart hospital. So I think that one of the things that surprised me a lot when I moved here was that there is a whole interconnected system of information. So if I went to get tests for a lab in any lab, I could the provider immediately would receive it without me ever needing to actually tell the lab practitioner that I needed that provider to receive it. So it was linked to my name, and as soon as I gave my name and my information to that provider, they could access my lab results. So it's very seamless here because there is this really strong mandate to have all information be interconnected for all healthcare services and for all different providers. There is a lot of emphasis now on telehealth as well. So there are services offered only through telehealth and a lot of services that are tailored for at home. So providers will visit you at home as well. There is this growing need for data-driven care, partly because there is so much data being generated. And one of the interesting things about the population here in the UAE is that it's a smaller country, but it is actually currently even a small percentage of the population is actually UAE born or UAE citizens. Between 80 and 90% are people who have come here to work and are actually not citizens. So one of the challenges that they are facing is that they want to be able to transition from depending too much on foreign talent to being able to work more with the local workforce. So they are very interested in training the current students, which are the UAE local students, in the top-of-the-line techniques related to health informatics. And that is part of what the focus of my role currently is. So they have brought in a lot of experts and professionals from different countries are all around the world to try to make sure that we are training the future UAE local citizens to be able to participate in the technological part and the technological growth in many areas, including healthcare, because they have realized that right now there is that dependency on external talent, and because it has been a quick transition, a lot of the local talent is still lagging behind. So when we are coming here as professors or lecturers, we are coming here with the role of preparing students for actual practice in healthcare informatics. So it is still a bachelor's degree, so we do go into detail into theory and a lot of the basic concepts, scientific concepts behind informatics, but we always are striving to link it with workplace realities. So one of the focuses of the program is to make sure that students have the chance to collaborate with local industry in the case of our specific program, Health Informatics Information Management, to collaborate with health organizations. And so we are making sure not only that they are trained with the basic scientific knowledge, but that they are able to work with the latest technology. And so part of our goal is to keep training students up using AI, using analytics, and all of the tools that will actually be used in a hospital setting, training them in a more applied way so they can just go and start interacting with the technology. At this point, they actually have the chance to go into work placements where they go into the companies or the organizations and start applying their knowledge into projects. But in general, the education is very focused on applied learning. So a lot of the learning is, not just about telling me how an EHR works, but how will you actually apply EHR in a setting like this hospital, which is in Abu Dhabi, so it's very, very much applied work. And for that goal, the teaching approach here is competency-based learning. So lectures are actual lectures where we present the concepts in a lecture format are limited. We more emphasize applied projects like case studies, system demos, and UAE specific scenarios. So we about the class is about half. So we spend maybe the first half going through the concepts or having the students present some of the concepts, and then we go on the second half to an applied case study or an applied exercise. And that also applies to the assessments. So the assessments are also not designed to just test knowledge, but to test applied knowledge. So they are asked to really put themselves in the place of an information systems manager and answer case-specific and UAE-specific questions. Like I said, they are currently included in their education is work placement. So they are working in collaboration. So their university is working in collaboration with industry partners to make sure that all students get work placement as part of their curriculum. So it is part of their education, and there are professors or lecturers that are responsible for tracking and making sure that the learning that they're doing in the work placement is actually benefiting the students, that they're not doing anything that might be considered busy work, or that for example, that they're treated as interns. The idea is that the industry partners are really giving them the environment and the tools to learn, and also getting, of course, the benefit of having this students support their efforts. They're not, the industry partners are not paying them. This is part of the educational program, so it's part of the university that is funding all of this placement. And part of the competency-based learning is also critical thinking and problem solving, because the idea is, so in summary, in the way we are trying to train students, very few of them were thinking of will end up in becoming academics or researchers. We are thinking that the majority, if not all of the students, are going to go into the field and become leaders in their country for informatics system management. So one of the things that I wanted to bring up in this presentation was what I have learned are the nuances in the context of the UAE. I put multicultural classrooms, but actually what I meant to say is multicultural settings and organizations, because like I said, when you go to an organization, just to back up a little, the UAE has a mandatory insurance requirement. So when you come into the UAE, you have to come in to work, or you come in to work in the UAE, you have to have an insurance that either your employer provides or you could pay for yourself. It's more likely that your employer provides it. And that means that people who come here will immediately have access to the healthcare systems, the healthcare services. So there are going to be a lot of different nationalities and different cultures accessing services. So it's a very different environment from a more homogeneous environment you could find in other countries. There is the idea that all of our education and all of the healthcare organizations have to be aligned with the Ministry of Health and the government's priorities. So here in the UAE, the Ministry of Health has a lot of say over how services are provided. So if the Ministry of Health, which is the case in the UAE, decides that we're going to use a lot of technology in the organizations, then organizations are going to have to incorporate technology in their services. So like I said, there are a lot of case studies of organizations already that are using successfully telemedicine, AI hospitals. AI right now, it's one of the all over, I think, not only here in the UAE, but here it is the government here in the UAE is very keen on making quick decisions on applying technology that they know is supported by science. So that is something that is, like, here it's a great hub for innovation because there is a lot of openness to incorporate technology and test it, as long as there is some strength behind the development of that technology. And what we have found is that there's also a lot of quick adapting of models from other countries to the local needs. So a lot of emphasis has been put on, what worked in this country, what worked in that country, what in Europe, and let's see how can we make it fit into our own environment. So they're not trying to invent anything new, but they are trying to make sure that they are generating this environment where innovation can, for the local context, can actually be produced. So I have a lot of students that are already very interested in, developing apps or developing other tools that they think will help the healthcare organizations that they are doing their work placements in. And here there's a lot of opportunities to get funding from the government or from other sources to develop those ideas and actually be able to incubate a company because of the support of policy and government in that area. So one of the challenges actually also becomes this rapid tech evolution, because it is, I would say that I've been able to experience a lot of successful technology implementation in the information systems area. But it is kind of quick, and there is like this, because there's a mandate, and a lot of the mandates here are meant to be implemented quickly. There is a lot of people running too fast in some areas, But I would say, like I said, most of the implementations have been successful. But and I think that as researchers, probably we want to, I wish I could have more information. I wish I could collect more information about the local environment before we go ahead and test this. But here it's more like, no, let's go, let's try it out, let's see what happens. So there's limited training and resources in the region. That's why this effort from my current organization, HCT, to train local resources, because they don't want to depend on international talent coming in. And there's this idea of balancing local versus global perspectives. So here in the UAE, it is I think that for me, it was a little bit surprising how open-minded they are for other cultures, but they're also very, very proud of their own traditions and culture. So there is this idea of how they want to be open to a more global, multicultural environment versus maintaining their own individuality and independence. And so that is a challenge that is currently being part of, even in our own setting of information and of health information management, how much of this technology, of this global knowledge we want to use as is, how much we want to develop locally. There is a lot of pull on that one, on that area as well. So like I mentioned, there is a lot of opportunities with investment in innovation here in the government. Students have many opportunities for for suggesting ideas, suggesting startup ideas, and there's going to be a availability of funding for incubating those. There is a high interest of digital careers, because this is what the government is emphasizing. There are a lot of students now that are also interested in being part of this new goal. So a lot of people are coming into the careers like information system management, where we are focused more on this innovation space and making sure that information technology and healthcare technology in general is efficiently used in healthcare organizations. And because of that, because of all of the expenditure on information systems, the mandates, all of that, there is an increasing and expanding role for informatics professionals. So our education has to keep up with that. So an example, we are currently, with some of my students, we're working on using some AI tools for transcription of provider-patient interactions. So we find, well, first of all, there's a difference of languages, because, like I said, there are many different cultures here, and the local language is Arabic, but the language that is used to communicate because of that multicultural aspect is English. But there are some people that come here with limited English and limited Arabic that come to work, and then just trying to figure out how AI can adjust to that setting for the transcription purposes, and how current transcription employees are going to be open to collaborating with AI, because at the end of the day, it's probably not going to be something that AI can take over. So that is the study we're working on, and it's something that the students develop as part of their education, and it is something applied, because their goal is to eventually continue this, to propose AI technologies that can support transcribers in their role. So for what I see looking around, looking forward, the AI, I think, is going to be something that is very much talked about in a global setting. Here in the UAE, it's very much something that is already being, they're looking at the government is supporting ways to apply AI in healthcare. There is more room for predictive analytics because, like I said, there's a lot of data being collected through, there's a wealth of data here because of everything being interoperable and connected through the platforms that the government has developed for interconnectedness. So there's a lot of opportunities for predictive analytics and development of patient apps because the population here is very used to using apps already. So here we have apps for everything, for government paperwork, for our kids' schools. Everything is done through apps. So I think that patients are very open to apps that might actually support their healthcare as well. So there's more to develop here, but I think that there is the potential for the UAE to be not only learning informatics, like developing the environment to learn informatics, but become one of the hubs for innovation because of their interest in funding this area and because of their real effort to make sure that they are training their students to be able to be at the top of a career in information system managers. And there's something really interesting here too, because about that collaboration between academia, industry, and government. So that is something that is very common here for all careers, and I've seen it for health informatics. So it is very, I wouldn't say easy because I haven't had yet the opportunity to, talk to some of the stakeholders, but I do know that it is expected that academia will collaborate with industry and that the government will also collaborate with industry and academia. So it is something that is not something out of the ordinary. Most people here in the UAE know that there are going to be collaborations in order to train the future professionals in each field. So that is something that is very interesting to me, and I think it has the potential to also open many doors for students here in the UAE. My conclusion, like I said, informatic education is critical. So we currently in this country, there are a lot of foreign talent, but at the level they want to reach, they also need to nurture their local talent. So it's going to be a key part of their goal, of reaching their goal to actually train professionals in informatics. The fact that we are very focused on applied context-based teaching, we believe is training, is preparing the workforce for what the UAE needs. So I think that this whole idea of having a very applied class, like applied method for teaching with cognitive-based learning is what the UAE needs right now. And I think it has been something of a learning curve for me, but I have grown to appreciate the importance of making sure that the students that come out of the program are ready to just jump in and join the workforce. And yeah, so there is this blend of global standards with local needs and a lot of emphasis on making sure that you reach standards, but not in in a blind, just, reach the standards because, we want to have that certificate saying that we are certified. It's more like, okay, these standards were created with the background of promoting excellence in quality, for example. Let's just make sure that we keep those global standards, but keep in mind that there's the local context, and always it's going to be different here because we're not the US, we're not Europe, but we still want to reach excellence. So how can we do that? So yeah, I think that's also something that has the potential to really, that mindset also has the potential to really fortify informatics and healthcare informatics here in the UAE. So that is my presentation. If you have any questions, I'll be happy to answer. Like I said, I only have had a few months here as a lecturer, but I have been learning a lot. So I hope I can answer any questions, but if I can't, I'll make sure to get back to you once I consult with my colleagues.
Thank you very much. We've had some comments that this was very impressive, and what you've done is noteworthy. But let me start in with some of the questions that came in the chat, and if other people would like to go ahead and unmute themselves for a question, I will pause to see if that happens. So one of the questions, amazingly, from one of the founders of HL7 was, are you using HL7 International or FIRE as a data transfer standard?
Yes. So the answer is yes. That is the standard being used. That is the standard we currently teach in the health informatics project. And I have a couple of colleagues that are very strong believers and supporters of HL7 standard that are, very, I think, obviously not as much as the co-founder, but very much experts on that area.
So speaking of interoperability, what is interoperable? What kind of EHR platforms or other systems are being used there?
So they actually have, so when you implement a system here, you have to make sure that it's implemented with, I think I mentioned the initials, but the SEHA, which is a system that actually is like, I would say like kind of like an information exchange, like an equivalent of an information exchange, but it's nationwide. So whatever system or EHR you use, which there are vendors here like Epic and others, one of the requirements from the government, and therefore the organization puts that in their contracts, is that the information should be able to go into that information exchange. So that's why any organization, labs, hospitals, clinics, all of them, whatever system they use, the requirement is that it has to go into that information exchange.
Let me pause, see if there's anyone who would like to ask a question live.
Does that include us?
Yes, go ahead. We have one here in the room.
Hi, thank you so much. Excellent, interesting presentation to get the global perspective and to remember that education is so important in executing these kinds of goals and ideals. As you mentioned, the government requires this data to go into an exchange. And I think there's a lot of conversation here in the US about privacy and security and ethics around these kinds of issues. And I'm curious, in the UAE, culturally, what you see from the students and the local community around those issues.
So that is very, very interesting because there is definitely a shift here from that perspective of privacy. So there is the need, there is a requirement for information security and making sure that the the information that an organization stores, and obviously the information exchange as well, is very secure so that bad actors cannot get to it. But at the same time, people here are very okay with the idea that the government has a lot of information on them, including that health information. So they're okay with that. One of the things that I've heard, and I've also gotten used to, is that there's a lot of surveillance here. And there's a lot of, whenever you do paperwork or you do a transaction of certain things, you have to connect it to your ID. So if you, for some reason, go to another place, they tell you, oh, you did this, you did X, Y, and Z. Because you had used the ID, that person can access that information. So people are very used to that here. So there is an emphasis on security, but privacy is not seen the same way as it is in the US. It definitely isn't. So that has been something that I think is fundamentally different from the scenario of information management in the US.
So let's talk a little bit more about the industry partners. I mean, one of our commenters said this multicultural approach is great, but wonders, are industry partners from various countries involved, not just within the UAE? I think you've mentioned that a little bit, but I think we'd like to hear a little more.
So the partners are UAE based, but I would say a significant number of them are foreign investors coming in. So there are a few US organizations that have their UAE sites here. There are other European ones that might come and set up their hospitals or provide different services here. So I would say there is a lot of, they bring their own culture, but the collaboration is only with local organizations, because there is a lot of emphasis on, yes, bring something from out here, but we want homegrown. So make sure that the students are getting the opportunity to see how it works here and developing their talents here.
Okay. We've got another question about the technology directly. This is a person from NC Central who asks, we have a few patient simulated robots at NCCU, and East Carolina is building a simulation hospital. Do you use AI-based patients for students to practice with?
So that's a great question. My field, in my department, we're not focused on critical care, so I don't have access to those. But I will say that in the when it comes to education technologies, the UAE government is also very keen on investing on those. So if there is evidence that this sort of training tools actually will help train future clinicians, they will invest on it. So I can't, I could consult on that, but like I said, they use a lot of technological tools. It's amazing to see what they have here.
Okay, let me pause for a second, see if there are
I have
other
a
questions.
I have
Go
a
ahead.
question. Is that me? Okay.
Yes.
All right. So my background is in acceptance and use of technology, right? So disparities in use of technology. And it's great that the government, first of all, let me start by saying great presentation. Good to hear more about your work and what you've been up to. But it's interesting and great that the government wants to embrace AI. And I looked up and I saw that I did not know this before your presentation. I just looked it up and realized that in the UAE, 99% of individuals or households have access to high-speed broadband, so fiber. So when we think about like the digital divide that we see in the US, we see in emerging countries, it doesn't seem like that is an issue. But I'm wondering, is there disparities? I don't know if you can answer this, but are there like disparities in who uses telehealth? Is it like the majority of the population are using telehealth? And I mean, depending on that response, how does that tie into the data that is used to train the AI tools? Are there any issues around the representativeness of like how representative the data is that are being used to train the tools? Especially when you consider that the UAE, I know that it has quite a lot of expert rates, right? They have a lot of, yeah. So when you consider that too, how does that factor into the increasing use of AI tools if there's not enough data to train the tools? Or is that not an issue?
Yeah, so that's a good question. So so there is different ways of access because, like you said, there's a lot of expatriates, but there's also different levels of how can I explain this? Different levels of education of the people who come here as expatriates, right? So I mentioned that there are a lot of experts that come here to implement those systems and that level, but there's also a lot of people that come here to do a lot of the manual labor. And because the population of the UAE is so small, they depend on a lot of that group of immigrants or expats. So I would say that the way that people from India or the Philippines or Malaysia access healthcare services is different. And it is markedly different from the way that the local UAE people actually access services. So they're much more likely to use telehealth. They are very used to doing everything through the apps, while maybe someone that is coming from a more, a system that is not that way, that wasn't that way since they were young, but is more, more personal, more face to face, will likely not embrace technology. I think that at this point, what the UAE is trying to do is to try to see how to incorporate all of this to a long-term solution that will address a more stable population. So I think that they are looking for a way to address both the needs of the expats and the locals, and they are in a way treating them as separate populations. So they are taking that into consideration, but they're not, they're treating them separately. They know that the patterns of use are separate. So I do think that probably that means that there's less information for training models for locals. But in general, yes, the two are very different. The two very different populations and the way how they interact with technology and healthcare.
We've got another question in the room.
Hello, my question is about students, as it's health informatics education and you are a faculty member, so your product is a student. Do you have a career track or something like this for a student? As someone from Mediterranean region, and I also volunteered with a student in Saudi Arabia, I find most of the students stuck between public health and computer science. They aren't specialists in public health or computer science, they are merged between both. So after graduation, they just go for the available one they can work in, but they don't have a track to go and companies to join with clear vision.
So I think that that's a good question, and I think that the applied education method used here is something that helps in that a lot, because so we emphasize in every class, this is what you will do as an information system manager. In every case study, you're the information system manager and your role is this. So we have created this specific tasks that are part of that profession. So they know what an information manager is. Now, if you're asking me in the market, I believe there is room for employment in as information system managers. We train them specifically for that. Actually, it might be complicated to switch between one or the other because we're very specific about teaching for that role, if that makes any sense. I don't think the students in our program could have that option to move to a public health career or to a computer science career, because it's so very much a informatics system manager career.
Let me ask Deborah Swain to ask a question.
Yes, it's wonderful, Dr. Moore, having you speak. We have a librarian that was one of our main administrators here at our university, but she's been in the UAE now for about 6 years. I think work closely or work with libraries there or the librarians for your research and planning.
So yeah, so that's an interesting thing, because one of the first things we got when we got here was dedicated training of the library services that are being offered. And then we also got so in my program, when I came into the program, we were about 40 people that came in as lecturers for different for information systems, but also other areas in the campus that I'm at. And the head librarian made individual one-on-one appointments with each of us to ask us how they could support us, or talk about the resources that the library has. So they are very much looking for that collaboration with the library services. And so far I have some ideas of how to take advantage of those collaborations, but I'm adjusting to being a full-time lecturer, which is, something that takes a lot of time. So once I get more into the flow of things, I would definitely be working more closely with librarians on the research aspect of my role.
Well, that's wonderful that the head librarian met one-on-one. That's good support. Very good to hear.
Yeah.
So if I could ask a little bit more about the prospects of your students, what are their employment prospects upon graduation? It sounds like from what you've mentioned, that they're pretty good. Is that accurate?
Yeah. So I mentioned that I work with local students, so they are UAE citizens. In the UAE, from the government, there's a lot of emphasis on making sure that the students who receive their degree are employed. So there are different paths that the students can choose. So they can either go work for a government organization. So I mentioned there's the Health Information Exchange. That's a huge undertaking. There's a lot of opportunities there. But there's also, local hospitals where they can work managing their information systems and so forth. But there's also, for those investors that I mentioned that come in, there's a requirement to make sure that they are also accepting students in order to keep their licenses to work here in the UAE. So some students, there's some programs where you can sign up, and as long as you keep a certain score in your GDP, you can actually GPA, sorry, in your GPA, you can actually get a job as soon as you graduate, as if you maintain. So those are directly from, I think, 2 years before they graduate, they sign up, and the organization already says, okay, I've got a job for that person, as long as they maintain their GPA.
Pausing to see if there are other questions. I do have one to follow up on the question of students. In health informatics, I think any of us who've been in this any length of time have recognized in the blink of an eye things change. So what programs or approaches have you been able to think about in terms of meeting that technological change for people who perhaps have graduated already?
So one of the things, well, I haven't had a chance to interact with a lot of students that have graduated already, but I know that a lot of the emphasis that we put on our students are giving them tools to manage technology without tying them down to a specific type of technology, and really incentivizing them to, look for the best tool, do your research, use these frameworks to design the information system you want, and then look for the right tool. And that if technology changes, evaluate your system constantly to make sure that you are incorporating the right technology, right? And I think because there's a lot of incentives from the government to keep innovating and implementing the latest technology in healthcare, that they have to keep up with the new changes. Like I said, actually the problem might be that they have to keep up with change that is too fast. But I don't think there's well, in my perception, I don't know if that's true, but there's very low risk of stalling technology-wise here in the UAE.
So, all right, so a question more focused directly on technological change. Are there efforts in the UAE to link personal technologies to EHRs and other kinds of information exchanges? The kinds of personal technologies like wearables to monitor vital signs and other indicators?
So I haven't heard about that. So that's a good question, because there is not as much. So I think that's partly cultural, because it's something that people are not really investing in. You don't see a lot of people using smartwatches here. I actually would like to learn a little bit more about why that is. It's just that because unlike cell phones or computers, where people use those every day, there's access to internet, there's not a lot of people to use wearables. And I think that might be part of the reason why there's not a lot of emphasis on incorporating them. But I do have to do a little more research about why it is that people don't usually use those sort of devices here.
Looking around in the room, any more questions online? Well,
I have one
seems
more.
like, go
Oh,
ahead.
just, yeah, one more quick question. So I know earlier you talked about some of the work that you are doing to ensure that your students are not subjected to busy work. I'm not sure if you expanded on that, but I'm really curious about what are some of the strategies that you have in place to ensure that students, because I know that's one of the things, right? You don't want students to be assigned to a place to go for a practicum or internship, and they're not really being able to utilize and maximize that opportunity. So I don't know if you can just talk a little bit more about some of the strategies that you are using in your program to ensure that your students are not being subjected to busy work.
Yeah, so one of the things is that it's this sort of work placement are treated almost like a class. So there are specific learning objectives, and there are site visits. So the person who is leading, which is I forgot there's a specific name for their role, but they're like they're responsible for making sure, consulting with the students if the learning objectives are being met, and also going to the site periodically to see what it is that they're doing. So it's just being very focused on making sure that students are actually getting what they were promised out of that. So I think that the difference is that usually in student placement, it's very loose. So you just send the students out there, and then you maybe get them to write some sort of report on what they learned. But here it's very involved. It's very like that's the agreement with the company. They have to meet these learning objectives. We will be visiting. We will be evaluating the type of work they're doing. So it's a lot of monitoring of what they're doing, pretty much.
All right. I think we're almost out of time. Last call. You
Yes,
don't
thank
have to
you.
go home, but you can't stay
Very,
here.
very informative. Thank you so much. Yeah.
Thank you.
Thank you, Dr. Mora. Thank you, everyone, for attending.
Thank you.
Yeah.
Thank you for having me.
Thank you.
Bye.